Hi, everyone. Happy Wednesday and welcome to Women's Health Tech Wednesdays. I am your host, Nina Joshi. Have two quick announcements before we bring on our guest for today. We have our Versali Challenge. The pitch day is November 21st. So come with your incredible menopause solution, and there'll be $50,000 in prize money available through that challenge. And we also have our December summit fast approaching at the beginning of next month. So make sure that you register for that event as well. And with that, would like to formally bring on a repeat guest. She was too good. We had to bring her back. Nuzi Barkatally, who is the VP of Startup Banking for Life Sciences and Healthcare at SVB. Thank you so much for being here again, Nuzi.
Thanks for having me, Nina.
Of course. Well, so happy to jump in. I know for many people on the call, they remember our incredible conversation, but for any new folks that we have, maybe a great place to start, Nuzi, if you could just share again a little bit of a quick introduction and how you essentially got involved in the healthcare and life sciences industry.
Yeah, of course. Yeah. So, as mentioned, my name is Nuzi Barkatally. I'm a VP at Silicon Valley Bank, where I cover both healthcare and tech companies. I say I get to do all of the fun stuff at the bank, which is supporting our founders and founder success, hosting a lot of events and dinners in the ecosystem. However, prior to my role at SVB, I've been an operator at various startups, mostly healthcare startups. And I also have a master's of research in healthcare and design with a focus on AI. My way into healthcare has just mostly been a personal one. I grew up with an autoimmune condition called Crohn's disease, and just have lived my life very passionate about how can we make healthcare better. And now I get to do a lot of that. And the work that I do, I see a lot of founders that are building really amazing companies, meet a lot of people that are working in the healthcare space. And I think I see myself as kind of like that glue and that connector to a lot of these things.
That's incredible. I would love if you could share a little bit more too around, I mean, we'll definitely dive into a lot of the work that you're doing at SVB, but I could only imagine, being able to have like personal connections to health, like I would imagine so many of us also have. Would love if you could share a little bit more around, how have those personal experiences, either with your own health or even just experiences, outside of your career that have really shaped your understanding of women's health, but I think healthcare more broadly in the work that you do.
Yeah, I mean, like it's such a challenge. I think growing up, I was diagnosed with Crohn's at 18 years old, and um, I remember as I navigated my career working on like product and, designing amazing experiences for customers, I could only contrast that with the experience that I had myself as a patient and, navigating just like the technology side of things. Like I remember at one point I couldn't get my blood test from one doctor to another. I had to like print out all of this stuff and then hand my doctor this. And she was like, I'm not gonna read this. Like, let's do a whole nother blood test. And I think I remember like during that time for like 3 months, I got like three blood tests a week just so that I could send it to like
Wow.
different doctors. And, I think there was just such a challenge in terms of both like just the technology. And then I think as a woman, like I've felt like from different clinicians that I am not listened to, people are not really valuing like what I'm saying about what's going on in my health. And like, I've definitely had doctors yell at me, male doctors yell at me. And I think it's very hard for women to navigate the healthcare experience. It's very hard for, just like different communities, underrepresented communities, like underserved communities to navigate the healthcare system. And a lot of my passion and my drive just comes from not only my own personal experiences, but like seeing other people and like just the lack of patient advocacy in that.
Yeah.
And I think, the companies that are really moving the needle on things are the ones that empower patients. So a lot of what I think about is like, how can we really empower patients in this healthcare experience?
I absolutely love that. And I think it's actually a beautiful segue into my next question for you, because I think one of the things that you were really highlighting is that the compassion, being able to empower others, how that's been such like a driver for you. Are there any other driver skills, traits, things that you believe have been very important or meaningful to your success?
I mean, working in healthcare is not easy. And,
Mm.
you're gonna constantly face like navigating either how do you build or how do you make things better in healthcare. And you have to have a really strong why for what you're building because it's not going to be easy. You have to have a lot of resilience. And I think for me personally, obviously, I have my own personal why. Just growing up with a chronic illness, I've had to be resilient in living in my own personal healthcare journey. And I think if you're trying to build in that space, like some of the qualities of founders or people that I see who are building, the ones that I see that are the most successful, including myself, are just knowing your why, going back to that. Sometimes you can get lost and you're like, doing something else. And then you have to go back to like remembering what is your why and then focusing on that resiliency of how can I keep going, like get knocked down but like how do I kind of go back to my mission. And I think even working at a bank, for me it's definitely much more than a job. It's how do I empower these founders who are building in the healthcare space, how do I connect them to the right people, and all of that. The reason why I put so much dedication into that, it goes back to like my own personal why.
I love that. That's very beautifully said. And I think a reminder for everyone to find their why and to like sticky note that, make sure that you are always kind of going back to it. So that's just a reminder for me too. I really like that.
Yeah.
Find the why.
Yeah.
Now I would love to dive in a little bit more into the work that you're doing at SVB. Would love if you could share a little bit more kind of about your role. I know that you were talking about how you not only are kind of supporting founders, but are also playing that connector. Yeah, so would love if you could share with us a little bit more about some of the things that you're up to there.
Yeah. So, I mean, a lot of what I've done at my role, I've primarily have worked on the early stage side. However, it's kind of expanded to like, supporting or, talking to a lot more later stage founders. But um, we are as a bank is how can we empower our companies, our founders to get to their next milestone? And,
Mhm.
we offer that in a lot of the products and services that we offer, and, including like we have no minimums, no fees on wire transfers if you're an early stage startup. But I think beyond that, it's how do we bring the value beyond just the banking? And I think SVB is amazing in that they hire like people like me who don't have a banking background,
Yeah.
who have more of a healthcare background and experience and more of a startup kind of background and experience. I can empathize with a lot of our founders. And, um, you know, my role is I don't have a portfolio of companies. I work really closely with my colleagues who are more on the banking side and have a portfolio of like companies and founders that they work with. But I'm there as a resource, um, both as a connective tissue and, ways that we can have important discussions within healthcare, ways that, we can be at the forefront of places, like a lot of conferences. So for example, right now I'm at the Behavioral Health Tech Conference that I don't know if anybody knows Solome, but she puts on, and it's an amazing conference. And so we like to be at the places where the real important conversations are being had within healthcare and within, you know, founders who are trying to build within the space. So that's a lot of my role here, which is fun. I'm very privileged to have the role that I do. It's a really fun job.
That's incredible. And I think because you've seen a lot of founders who are kind of right at that early stage, for any of those that are kind of on that call, like ideation, pre-rev, like whatever that kind of ends up looking like, what are some of the challenges or the hurdles that you kind of see a lot of startup founders in those really early stages kind of make, I think, when it comes to banking, but also, their business overall that you could shed some insight into?
Yeah. Yeah. So obviously you want to find the right partners with you, like
Mm,
as you're building. And so that includes obviously your banking relationship, maybe your law firm that you're working with, your accounting firm that you're working with, or like an accounting person that you're working with. But also, the putting the right people around you. So your advisory board, any of the first employees that you're hiring, like making sure that everybody's in alignment and supporting the mission of the company. Then on the other side, like the actual business, I think some of the challenges building within healthcare, especially if you're planning to sell to payers or to employers, is, I'll have a lot of founders ask me, so what's the playbook to sell to payers? And I'm like, there's not really a playbook. And, you kind of have to just navigate that, but you should build your business in a way where you're taking that into account, that it is going to be a long sales cycle. It is going to be messy and complex to kind of navigate. How do you get in front of those people that you're selling into? And so like making sure you're thinking about that. I know a lot of it's it's easy to be like naive coming into building in healthcare, and you're like, this needs to change and we need like better electronic health records. And I've seen a lot of founders who've come and then had to really pivot really quickly because they're not necessarily fully aware of the challenges that they're going to face in building in healthcare. And so I think it's really important to talk to a lot of people who've tried, because
yeah.
if you think that you are the first person to try to do that idea in healthcare, you are not. There's definitely people who've tried to build before, and whether it's like, the policy or the technology
Mhm.
or, something that didn't allow that then, hopefully there is a possibility to allow those things to happen now, but it's important to talk to those other founders who've tried before you, because there's definitely, your idea has been tried before. And I think, um, yeah, just it can be easy to feel like healthcare, if you're building a company, there will be competitors around you that are probably, if there's an opportunity, there's going to be multiple companies that are building in this space. And it can be easy to feel like, okay, how do we get into this one payer before this company or whatnot? Like it's easy to be competitive, but I think you will find that there are more people and more founders that are willing to collectively help each other, maybe to a
Yeah.
certain extent. But
Yeah.
I really think that within healthcare, there's such a community that founders are really wanting to help each other. People are really wanting to help each other. You can see that with like, communities like health tech nerds, and
Mhm.
like that for us as in LA at least has turned into like a group of people who meet in person every month.
Mhm.
And I think people really understand that there's such a mission to like move the needle within healthcare, that you can connect with people and you can talk to people. And I think making sure you're seeking that out is really important.
I love that. And yeah, you bring up so many amazing points really around like the power of collaboration and like the knowledge sharing and kind of
Mhm.
not feeling like you are doing anything in isolation. Cause I think
Yeah.
that's very much not the case anymore, which is
Yeah,
great.
yeah, yeah, yeah.
I'm also so curious to, what you were talking a lot about when it comes to finding like the right partners, whether that's advisors, partners like banking, legal, etc. I think for a good amount of founders, there can be a little bit of pressure of like, this is a relationship that I'm going to want to have for a long time. How do I find like the right partner, whether that is a company or kind of an advisor? For you, are there any words of wisdom you have when it comes to like what are some things that founders should be looking for to see if someone or something is a good partner for them? Any like guidelines?
Yeah. I think it depends on the type of partner that you're looking for. So,
Mhm.
if it's, your kind of services around you, like it's important to just make sure there's kind of a lot of alignment in terms of like what you're working towards. And I mean, if relationships can take you a long way. So like if you have a relationship with an individual person at a particular law firm or a particular bank, like honestly, those things, those relationships will take you really far. And that goes for, obviously, like if you're looking to collaborate, you're looking for advisors, you're trying to think through who you should hire. But
Mhm.
on that side of things, when it comes to like who you should hire, who your advisors are, who should your investors be. I think the biggest thing is making sure there's alignment in your values. Um,
Mm, I
and
like
and I mean this in the sense of like how you're going about to build your company. And if, those values aren't in alignment and you're feeling like things are off, then maybe they're not the right advisor, maybe they're not the right investor, and maybe they're not the right employee for you. But and what I mean by values is like
Mhm.
really digging deep in terms of like, what is your long-term plan? And like, how are you thinking about going about building your company? What is important to you? Um, how are you planning to go about building that company? How are you thinking about the culture that you're building? Um,
100.
and these seem like, oh, do you talk about this stuff early on? Yes, you should. You should talk about this stuff early on, because if those are not aligned, you will be in a very precarious situation at some point for sure.
Yeah, that's wow. I think that's really, really helpful. I think when it comes to the shared values. And I think you bring up a really good point about like kind of knowing what those are and kind of using
Mhm.
that as like almost like a North Star when it comes
Yeah,
to a lot of relationships.
yeah.
Um, And I think on that note too, I'm so curious because I wonder if maybe you get this a lot too from really early stage founders. How soon is too soon to be thinking about your banking needs, to be thinking about when to start to engage? I know some founders, they may have different timelines of maybe I don't need to worry about banking until my first raise, until my first employee. But do you have any
Mhm.
insight when it comes to how soon should they start to think about these things?
Yeah, I mean, I'm a little biased, I will say that, but like I think like as soon as you file for like creating that company, like
Mm,
you create the LLC or you create the C corp, whatever, when as soon as you do that, I think you should think about your banking for sure, and start having conversations as well. Hopefully you've already kind of engaged with the law firm as well at that point. And a lot of these startup law firms, and obviously like with us like at SVB, like our products are tailor made for early stage startups. So like with law firms, sometimes you can find a firm that can defer the fees because you're an early stage startup, and for us, there's like no minimums and not no fees in terms of like transfers or wires and stuff like that. um but I think the reason why you should do those things early is not just for those like the products and stuff like that. It's like I mentioned, it's for the relationships, because
mhm,
you're looking at who can provide an amazing who can be a really great relationship, who can provide the types of ecosystem connections that you're looking to get
definitely.
connected to. I think that's where these kind of vendor services can be very valuable, and you want to align with the right people, and it takes time to figure out who those people are. Again, like thinking about the values and the relationships that you want, it takes time to kind of see who's going to have those authentic relationships with you, who's going to be honest, who's going to be helpful.
Mhm,
And so I think doing that right from the beginning is so important, because it can really take you far if
definitely.
unless as opposed to like if you didn't think about those things.
Totally. It's funny because I definitely feel like my perception of like these support services, like banking, like legal, I think I've always had the impression that it's just like so transactional, the way that you just
Yeah.
when you think about a service. But I think realize like just kind of continue to realize just how like there is so much of a layer of support around a lot of these services. And I think that's kind of cool that there
Yeah. I
really
mean,
is this infrastructure.
it can be transactional. So
Yeah.
that's for sure. It can be transactional, but can you find a partner that has more of that relationship behind
Totally.
it? Like I think um there's always something like I think when you're navigating, I think when I talk to founders, you can get into the mode of being very transactional. Like I think I've
Mhm.
seen a lot of founders get into that mode because you're trying to optimize, and that's great. You're trying to optimize when you're at a conference, when you're meeting people. Um, but like I guess what sometimes founders don't realize is that um you will really, if you connect with a relationship, whether it's like a health system, a bank, or whatever it might be, it's really that connection and that relationship behind it that is gonna move the needle in your business.
Hmm.
And so it's very important. So it's important to kind of think through how can you balance the transactional with the relationship.
100%. Yeah, I think that that makes a lot of sense, kind of that balance. And I think on that note, I'm also so curious because you were, just about relationships and community and how all of these things like play such a force. I know you are in conference central right now with so many going on.
So
Would
many.
love, yeah, like I love it, but would love to share some for those of us that aren't able to go to a conference. What are you seeing like in the healthcare space? Is there anything that's interesting new innovation stuff that you see a lot of traction towards? Yeah, let us live vicariously through you a little bit.
Yeah, yeah. I mean, there's a lot going on. And I think, health. So I was at health. We had LA Tech Week, being in LA. Now
Mhm.
I'm at behavioral health tech. Um, there's definitely a lot of how can we focus more, the question of how can we focus more on women's health. Um,
Mhm.
I think, in terms of other areas, there's like, how can we look at health equity? Especially if you're within the Medicaid population or like, the CMS, like employers, like there's all of that kind of like figuring out how do we provide more access, but in an
Yeah.
equitable way. There's a lot of focus on how are we serving our aging population? How do we kind of build around that? I think it can be, I think as someone who really cares deeply about healthcare and also someone who works at a bank that supports like VC backed startups,
Mhm.
sometimes the conversation can really focus around like, what is VC backable? What's scalable? How much did this company raise? And then on the flip side of it is like, well, which of these companies are kind of moving the needle in terms of outcomes and like,
Right.
how are you seeing some of those changes? And maybe, maybe your company shouldn't be VC backable or like, how do you have that questions? There definitely needs to be more, I think like financing options within the healthcare space to figure out like, how can you build an innovative company and maybe you have to kind of think through like is this a company that should be VC backable or is there a way to kind of build that company, bootstrap it or and that's very hard, but like are there ways, to build that company differently? And this is just more of my own personal thoughts on this, but I think being really super clear about what you're trying to build and understanding where you want to take that company and what makes sense for
Mhm.
you. Um, so I think a lot of the conversations I'm seeing are a lot of founders are trying to think through like, you know, what type of company I want to build and how do I want to build
Yeah.
it. Um, and it's really dependent on the space that you're building into. So I think that conversation I've been hearing more and more
That's
lately at the
fascinating.
conferences. Yeah, yeah,
That's so interesting that I just even that idea of like what are the potential for like financial like options that kind of go beyond VC because I think that there is definitely an expectation or an assumption of like what a VC backed company is going to look like.
yeah.
And to your point, that may not always be like the best fit. So that's fascinating. I'm so curious to see what comes out of those types of conversations.
Yeah, yeah. I mean, I think as you're building to, have conversations with investors, have conversations with other types of founders who've gotten other types of funding and seeing what's right for you.
I love that. Wanted, I think on that note too, of just all of the conversations that you're having, would love to kind of pick your brain a little bit because I know, places like these conferences, networking events, etc., can be so important, so pivotal. Would love if you could share as someone that's probably just like been doing this so often, do you have any like conference like networking tips and tricks for founders who want to make meaningful connections, but there's definitely a way to go about it. So if you have any, that would be helpful too.
Oh, that's so interesting. I don't think anybody's like really asked me that question. Um, I I think like I'm not when I'm networking, I'm not necessarily being like, oh, I need to only talk to founders and I need to only talk
Mm,
to investors and like I'm just so open to having all types of conversations
I love that.
and you know you can there's so many interesting like people that come to these conferences, and it's really it's really helpful to make sure that you're able to be present and like to be able to have, to try not to be transactional in those conversations. But the way to go about doing that is like you can connect with something about something with anyone. And so
Mhm.
figuring out like what you can connect on. Obviously, like one question that I like to ask is what brought you to this conference? Like what are you
Mm.
looking to learn, or who are you looking to meet here? And that's always interesting to me. Um, and I think also if there's a way for you to um, provide value in some way, like how can I be helpful to you? Like what can I do for you? Making sure that you're able to offer that. And maybe that sometimes comes in that conversation, or maybe that
Totally.
sometimes comes in like, maybe you host a little kind of like lunch at, you say like, hey, 5 people meet me here, and like, being kind of like a glue or a connector to people at a conference. I always like to introduce other people. So
That's nice.
yeah, like at a conference, I love introducing other people, and I think, they can get value out of that. So that's kind of one of my strategies,
I
is to be able to do that.
this is great advice. Just in general.
Yeah,
Thank you, Nuzi.
yeah,
This is
yeah.
so helpful. We kind of have our final question now that we're ending our time together, but before we do that, wanted to get an audience question that we have, which is, Nuzi, you're such a great conversation. Do you do any type of consulting on the side for founders that would just want to pick your brain more,
Oh
or other
my
ways that they
gosh.
can reach out to you?
Yeah, no. So I'm always happy to chat with, people who are building within healthcare. I can't technically do any sort of consulting while being at a bank. But yeah, always open to having conversations with people, whether you're building, as a founder, or you're working in healthcare any other way. I'm happy to have, and I can just share my contact here as well.
And I think we have your LinkedIn in the chat too.
Okay, perfect. Yeah, people can like to message me as well.
Perfect. Awesome. And then our last question that we have, you have been such a wealth of information as it relates to, just helping founders, but also, I mean, as a leader as well, and being in this industry for so long, would love if you could share any words of wisdom for everyone on the call, whether they're a founder, whether they're just a healthcare operator, any career advice that has helped you along the way.
I think I might have said this in the last session, but my career path has been a very windy one. Like, I've worked at startups, and now I work at a bank, and like I've done a lot of different things in my career, but I've never been somebody that's been like, in 10 years, I want to be this, like, this is what I'm working towards. I really try to focus on where am I at right now? Like, what's important to me right now? What am I curious about? And really trying to lean into those things. And that has kind of opened like the door to meeting various people, having like really interesting conversations. And I just allow myself to go down that path. And I probably mentioned this last time, but like I meditate, and my meditation teacher always says like follow your charm. And
Hmm.
so it's a lot of that, like follow what's like really interesting to you. And I think your passion and what you care about will come through in the work that you do, and people will really like resonate with that, and they'll like, you'll see those opportunities unfold. And so that's kind of like my career advice. I think it's not for everybody, and it's definitely not been easy being like South Asian and having South Asian parents who like, probably at one point wanted me to be like a lawyer or a doctor or something like that. But for me, it's allowed so many different kinds of opportunities come my way, and it allows me to be like passionate and happy in the role or the things that I do in my career.
I love that. Even if you said it last time, I mean, just rehearing it, incredible. That was so inspiring, Nuzi. Thank you so much for
Thanks,
taking the
Nina.
time to chat with us today. Always such a pleasure.
Yeah, so nice. Thank you all for having me.
Thank you so much, Nuzi. Make sure that you join us next time for our next Women's Health Tech Wednesdays. I wanted to give a quick shout out to our incredible sponsors for sponsoring this conversation, as well as one last huge shout out to our incredible guest. And we will see you all next week. Bye, everyone.